but they're actually looking in the wrong location.
Okay.
So the colonoscopy, the doctors, they put the tube in,
Yes.
and then they go up high to the colon looking
Mm-hmm.
for those precancer
Mm-hmm.
lesions or those polyps, but that's not where anal cancer is.
Hey everybody, I'm Dr. Mo. I'm down here at Wellness Home of Chicago. I'm here with two very important guests today. I'm just really excited because I know these two people. They both have taken time on their schedule to talk about a topic that I got to tell you, it just simply doesn't get discussed that much. And so, what I'm going to do is I'm going to introduce them both, and then I'm going to let them have a great conversation. And I'm sure you're going to enjoy it. We have Dr. Bucher from ADC Midwest, and we also have Toni Valentino. So, to both of you, I want to say welcome to the Wellness Home of Chicago. And I know we have a lot of butts to talk about,
Mm.
so I'll let you get started.
Thank you, Dr. Mo. How are you today?
I'm great.
That's
Thanks for having me.
amazing. You're welcome. Welcome. Listen, what exactly is anal dysplasia and how does it relate to HPV and anal cancer?
Well, anal dysplasia is just a fancy word or name for abnormal cells in the bottom, in the anus.
Okay.
And when people have a persistent HPV infection or human papillomavirus infection, it causes changes inside of those cells so that those changes over time can progress to anal cancer in some people.
Can you explain the risk factors?
Sure. You know, Anal cancer is really not that common of a cancer,
Mm-hmm.
except in certain high risk groups. And the high risk groups that we really want to focus on are people living with HIV, whether they're men, women, or trans,
Mm-hmm.
they're at higher risk. HIV negative, men who have sex with men, women who have a history of vulvar cancer or vulvar dysplasia.
Okay.
It's just down in the same general area, and HPV likes both of those types of skin types. And the last one that we see a higher risk for cancer are transplant patients, 10 years out because they're on immunosuppressants.
Interesting.
And that immunosuppression causes HPV to hang out and cause those changes.
Hmm. Okay. You're talking a lot about anuses today, huh?
I
Okay.
am. That's my
Is
specialty.
that your specialty?
It is.
How common is anal dysplasia and are there any specific demographics or populations at a higher risk?
So the how common is anal dysplasia?
Yes.
Well, for instance, we just finished the Anchor study, which is an anal cancer prevention study.
Okay.
And before we did the study, in HIV positive men who have sex with men, we thought the incidence rate was about 40 per 40% would have HSIL. We found in the study that about 60% will have those precancer, and HSIL is another fancy name for that, HSIL lesions.
Mm-hmm.
In women, we thought the incidence in HIV positive women was only about 30% would have these precancer areas. In the study, we found it's like 48%. So a high number. In trans women, about 67%.
That's high.
It's huge.
Wow.
Huge number. High risk.
Wow, that's really something. Okay, what are the typical symptoms or signs that someone might have anal dysplasia and when should they seek medical attention?
Well, that's an interesting question because most diseases, when you have something, you have symptoms. Anal dysplasia usually don't.
Wow.
You wouldn't have any kind of symptoms
Mm-hmm.
unless it was really progressed and pronounced. So, which is why it's really important to be screening because the screening process will actually find people we need to evaluate further because they have no symptoms. If someone has anal cancer, though, there are symptoms to look out for, like itching, anal bleeding. You might feel a mass. When people have those types of symptoms, they're like, oh, it's just a hemorrhoid. It's like
Yeah.
nothing to worry
Yeah.
about. And I've had some people come in where they are describing those symptoms, and my doctor's like, oh, giving me a hemorrhoid cream and say, without even looking, and they come in and there's a big mass there that's not a hemorrhoid, it's a cancer.
Yes, sometimes people just overlook those type of things without really going to check those things out. It can be something more serious than they think.
Exactly.
Yeah.
And the thing is that the patient doesn't want to go down there,
Mm-hmm.
and the doctor doesn't want to go down there. So it's a perfect storm, and like no one wants to take a look
Mm-hmm.
at what's going on when they really should.
Okay. So, let me ask you this. What role does HPV play in the development of anal dysplasia and anal cancer, and how can it be prevented and managed?
Well, let's first of all talk about human papillomavirus, HPV, and
Okay.
how it relates to that. So when we talk about HPV, we break them into two groups.
Okay.
So there are low risk types of HPV and high risk types. The low risk types hang out in cells, might cause warts, but they don't cause cancer.
Mm.
We're more concerned about these high risk types, particularly types 16 and 18, because those are the types that interfere with how cells work
Okay.
and can cause those changes called dysplasia, which
Mm-hmm.
can progress to cancer.
Okay.
So, the biggest way to prevent in the first place would be to get the Gardasil vaccine, the HPV vaccine.
Okay.
But, the vaccination rates are really low, and a lot of the people that have anal cancer now or predisposition to it, Gardasil wasn't available.
Okay.
So they wouldn't have gotten vaccinated. So it's really on us. We're really pushing that people who are sexually active
Mm-hmm.
should be vaccinated from age 12 to up to age 45. And
Yeah.
it's the only cancer prevention vaccine that's out there. It's
Mm.
amazing that here you could do something to prevent oral cancer,
Mm-hmm.
anal cancer,
Mm-hmm.
penile cancer, cervical cancer, that parents wouldn't want to give their kids this, but we don't.
It's a lot of the
All this,
cancers, right?
all this anti-vaccine stuff. It's crazy.
Okay. Um, what are any specific uh, screening methods or tests available for detecting the anal dysplasia, especially in individuals with higher risk, as we were just
Okay.
discussing?
So when we're talking about those high risk groups, we're also looking at age.
Mm-hmm.
So,
And what ages are those?
so for the HIV positive MSM
Mm-hmm.
and the trans, so individuals who are 35 and older should be screened.
Mm-hmm.
Other HIV positive people, like straight women or men who have sex with women,
Mm-hmm.
start at age 45. In the gay men who are HIV negative, you start at age 45.
Mm-hmm.
Those other two high risk groups, the transplant and the vulvar, transplant would be 10 years after, no matter what age.
Mm-hmm.
And in women, a year after diagnosis of one of those. And the screening tests are really simple to see if you need to have further testing done. It's just either an anal cytology, which is also known as an anal pap smear, like a cervical pap smear you might know about, or high risk HPV testing. It's
Okay.
all done on one swab. It goes in the same bottle. It's very easy and simple to do.
Okay. What are there any misconceptions or stigmas you might say?
So one of the big misconceptions, I have people coming in and they're like, "Oh, I don't need to be checked
Mm-hmm.
because I just had my colonoscopy."
Mm-hmm.
And I'm like,
Maybe they don't
"Well,
want you to do all that digging, right?
they don't want you to do all the digging, but they're actually looking in the wrong location."
Okay.
So the colonoscopy, the doctors, they put the tube in
Yes.
and then they go up high into the colon looking
Mm-hmm.
for those precancer
Mm-hmm.
lesions or those polyps, but that's not where anal cancer is. And by the time they put the scope in, they're past the area that I pay attention to,
Mm-hmm.
which is just the anal canal, which is about an inch or an inch and a half inside.
Okay.
So, you know, trying to explain that they're actually not looking at the area that should be looked at is like big because everybody thinks the colonoscopy should check for that, which it doesn't.
Mm-hmm.
The other thing is that, people think they have something else like a hemorrhoid and it's really cancer or something like that. So, misconceptions, taboo,
Mm-hmm.
people really don't want to go there. And so we're
It's
trying
kind
to
of
get rid
iffy.
of that,
Yeah.
that, taboo, afraid. don't go there. It's like
I mean, a lot of people have gone there, right?
a lot of people have gone there, and they're going to continue to go there.
Right. So I mean, how hard could it be to actually get checked out to make sure you're good, right?
Right.
Yeah. So, Dr. Bucher,
Yes.
as we continue to talk about butts, right?
Right.
As we continue to talk about butts, and that is your motto, isn't it? What is your motto again? What
Your
was it?
butt is our top priority.
Mm.
Should be, right?
Your butt,
Your butt.
not my butt, maybe some other butts. Okay. So, as we move on into the questionnaire, can you tell me what treatment options are available for individuals diagnosed with this anal dysplasia, and what are their success rates?
So, anal dysplasia, when we're talking about that, we're the kinds of dysplasia that we treat are the precancer lesions. And
Okay.
those are the fancy term for that is high grade squamous intraepithelial lesions,
Now, what the heck?
which is why we say HSIL,
Okay.
anal HSIL, because there are less uh, damaging. How do I want to say that? That
Just say it, honey.
so there's lower degrees of dysplasia called low grade dysplasia.
Okay.
And on that, we don't usually treat. We want to treat those precancer HSIL lesions that are high grade.
Oh.
And typically, what we use ablative type therapies, usually but using electrocautery, burning off those surface cells. Um, and that's mostly the standard of care. In the Anchor study, that's really what almost all the sites used. And it works really, really well because you can actually focus right on the lesion. There are some topical agents that you can use dermatologists use for other types of skin cancers.
Okay.
But, patients have to apply them and you can become very irritated. And, applying things with your finger inside of your butthole is
Oh
really
my God.
difficult.
Now you're
So
applying fingers, huh?
you have to squat over a mirror. You have to put your leg up on the toilet stool and make sure you hit the hole
Well,
perfectly.
I'm sure that wouldn't be hard for a lot of them.
Doing the squatting.
Yeah, the squatting and the
The
legs up.
squatting,
Yeah.
yeah. But especially if someone else was helping.
Oh
But
yeah.
but those are like the usual types, and we're always looking for new ways to treat this
Okay.
with research protocols and whatnot.
Great. What are some of the lifestyle changes, uh, preventive measures people can take to reduce their risk in developing anal dysplasia or HPV related anal cancer?
So there isn't a lot that you can do. I mean, the thing with HPV is it's spread by skin to skin contact.
Okay.
So when you're rubbing, touching, and feeling, you're going to spread it. So I know. So vaccination is like key. The other thing is
Kind of
that
like the rubbing and touching, but go ahead.
rubbing, touching, feeling. But the thing that most people have control over would be smoking. So smoking is a risk factor
Okay.
for dysplasia and that. So stopping smoking would be great.
You guys
Other
hear that? No smoking.
other than that, there's not a lot to do to prevent except with the vaccine.
Okay. All right. And what is this vaccine? What is that?
So that's the HPV vaccine. It's called Gardasil.
Okay.
And it protects against 9 different strains.
Okay.
So 2 of those low risk types, the most common types that cause warts, so it prevents that. And then 7 of those high risk types that can cause anal dysplasia or anal cancer.
Now, is that the only treatment, the HPV, or are there others?
That's a preventive.
Okay.
So it's going to prevent someone from getting infected with those strains. So if
Okay.
you get that vaccine before you start having sex, then you're almost pretty sure you won't develop any type of HPV related cancers.
Sounds good to me.
Yeah.
And sounds good to you too, I'm sure. For those of you that are okay. Anyway,
Let me so since you did that,
yeah.
let me also do one other misconception that I forgot to say
Come on, give it
earlier
to me.
is that you don't have to be having anal sex to get HPV in your
You can get
bottom.
it from the other way, can't you?
You can get it just by touching around your opening,
Ooh.
rubbing. So you don't just have
Y'all
to
see
do
that?
this. You can
You
get
don't
it
just
like
have to do
this
this. You can just do it like this.
and catch it that
You
way.
got, y'all got to be careful, okay? Y'all got to be careful. Listen, how does the healthcare system currently address anal dysplasia screening, prevention, and treatment? And are there any areas of improvement?
Well, there haven't been any standard of care guidelines. So
Okay.
when you go to your doctor, most of them will haven't been screening for it with the pap smear or the rectal exam or the
Mm-hmm.
HPV test. But since the Anchor study concluded and we showed that treating these precancerous lesions in HIV positive people will decrease anal cancer by 60%, the standard of care is changing for people with HIV. So the guidelines, new ones are coming out. They should be out any day now, recommending that those groups that I had mentioned earlier,
Mm-hmm.
over 35 with HIV, be screened, and then those have those lesions treated.
Okay.
The International Anal Neoplasia Society, the group, the butt doctor group that actually specializes in
Now,
this
where are they
area,
at, the butt doctors?
uh, well, there's a whole specialty just for that. And we
They
have a
have.
meeting like once a year, and we all
Mm-hmm.
get together and talk about butts
And talk
and
about butts.
talk
And
about
this,
butts.
listen, this is not to scare anyone. This is just a conversation that needs to be had so that we can keep ourselves healthy and, um, uh, moving forward in life without any uh, future hiccups or anything like that, right?
Right.
Yeah.
And so that society actually just published their anal dysplasia guidelines on
Mm-hmm.
screening and treatment for all those other groups that I mentioned. So, but doctors are going to become more aware.
Mm-hmm.
And our goal is really to get patients aware who are in these high risk groups saying, hey, why aren't you doing my pap smear? Why aren't you doing my HPV test? I need to be
And
screened.
that's another thing, not to cut you off, but this is not just for the LGBTQ plus. This is for everyone. So don't feel like you're excluded or anything. This is for everybody, whether you're straight, gay, non-binary, bisexual, whatever. Make sure you take care of yourselves, okay? Because I love you guys.